Hey, how are you guys? Hey, Susan Luke Harris. I'm glad you're on here today. It's the only name I recognize. It's nice to have a friendly face. Awesome. All right, well, since it's 9 o'clock, I am going to get started. I always record this because if anyone's like me, it's really hard to stay on super late. So I will stay on. You guys who are on live with me, you have the benefit of the question and answer at the end. This will usually go about, I would say, 10 minutes or so, and then I'll stay on at the end for question and answer, but I'll stop our recorded section of this broadcast. Hi, my name is Sarah Tugender, National Field Manager with nutraMetrix, helping you make this your most effective and efficient year yet with nutraMetrix. I would like to talk about specifically in the proposal when you're doing your planning and your prep, how you decide which products are going to go into your proposal with your healthcare professional. Well, the thing at first is you have to do the discovery meeting. If you haven't done the discovery meeting, go back and redo the discovery meeting with the healthcare professional. Otherwise, it was just an intro meeting, which is fine. That happens sometimes. Just because it was the first meeting, it doesn't necessarily mean that that was the discovery meeting. If you didn't have your practice planning guide with the 2-page discovery meeting questionnaire in front of you and you filled out the answers, that is going to be your key for filling out the proposal. So it's all right if you go back in. And what I usually just say to the healthcare professionals, I'll put that questionnaire in a notebook or on a clipboard, and I'll just say to them, if it's okay with you, I'd like to take some notes during this conversation. So they know while I'm looking down and looking back up and looking down and looking back up that I'm really just taking notes. I'm doing a lot of active listening, and that's totally fine. And they'll usually just keep on going on and on answering my questions. I'll refer back down as I'm taking notes to see what my next question is. Because what we really want to get is their top 3 patient complaints. That's one of our questions in our discovery meeting. And this is where we're going to then roll out our phase 1, our phase 2, and our phase 3. And so if you don't really understand, if they're saying, well, I don't know, I'm feeling like patients are coming in because I'm a chiropractor and they're coming in because of car accidents. Okay, well, that's not really like a patient complaint. That's what happened, and that's why they're coming in. But what are you seeing? Is this a neck injury that's causing sleepless nights? Is this a neck injury that's causing pain? Is this a neck injury that has systemic inflammation? Like, I'll probe and ask a little bit more questions to try to get to what one of their chief patient complaints is that's going to fit one of my patient protocols. So if I'm working with an endocrinologist and he's saying that patients are coming in, and one of the main reasons is because he needs to monitor their blood sugar levels, well, then I know that I'm going to go for my blood sugar maintenance protocols and put together support that's specifically surrounding, some blood sugar support protocols. And so I'm trying to work and dig to understand. If you don't understand, it's okay to ask the health professional. Just say, I don't understand. What do you mean by that? So sometimes you need to slow down a little bit in order to speed up. So it's a very important question. The next thing is that when we're thinking in our themes, so we're thinking in terms of what 80% of the patient base is experiencing. So if this is a internal medicine physician, and he's saying that one of the 3 patient complaints, or one of the complaints is there's low energy, people come in because they have some GI issues, or people will come in, just for their maybe because they're getting older and just those like general aches and pains. Well, I might say, well, out of those 3, like out of the last 10 patients that you saw, doc, would you say that 8 of the 10 are, experiencing one of those 3, and which one? Yeah, I would say, out of all those 8 of the 10, Sarah, they're all coming in with some sort of GI discomfort. Okay, great. Now we have somewhere to go. Now I know what phase 1 is going to be. And I know that because I figured out what 80% of the patient population is complaining about. Now I know which products I can roll out and what my first protocols can be with this physician based on, that what most of the patients are experiencing. And I'm targeting a very specific complaint and concern. My background, I spent a few years in the pharmaceutical industry. And when we would effectively ask for a sale from a practitioner, I wouldn't say, Doc, I need you to put all of your patients on my pharmaceutical product. No, I would be very specific. I would say, Doc, the next time that a patient comes in and she's experiencing menopausal symptoms, I would like you to think of, my therapy. The next time you see someone and they're having some issues and they've been calling in a lot with lots of triage calls, I want you to think of my product. I was asking for very specific patients, and this is what we're going to do. We're going to do the same thing here, and this is going to be able to affect a lot of patients. But you have to ask for a very specific patient because you're asking for one that this practitioner is going to see 8 out of 10 of the time. Now, he might not or she might not recommend our products. It might not come up in conversation 8 out of 10 times, but at least we know that 8 out of 10 patients will fit the profile with the protocol that we're recommending. I'm just explaining this to you. This isn't necessarily what we explain to the healthcare professional, but I just want you to know a little bit of the psychology behind how we're picking these products. And then from there, we're going to put these into a small, a medium, and a large size offering. We do this through what we call the directed system support. So it's not necessarily that the small is going to be the lowest cost or price item. It's going to be the simplest to roll out with the biggest effect on the patient base. So what is that one product or that one package that's going to have the biggest impact on this patient? If they took nothing else home but this one product, they're going to come back the next time to their follow-up visit and they're going to say, you know what, Doc, that made a difference. That right there that you put me on, that made a difference for the symptoms that I was experiencing. That worked for me. So when we're putting this together, that's what we're thinking of. Don't overthink it because this is just the initial proposal. And of course, as you know, with our marketing wheel, we're going to continue to monitor. We're going to continue to adjust. We might work and tweak on these protocols as we go. I walked into a proposal and I think that I'm going to lead with, some GI support, but it really turns out that, if I could solve for that practitioner and just some general, age management, something related to, supporting the aging process, that was going to make a difference in her practice. So I'm willing to bob and weave and go through this and say, this is my proposal, but I'm going to leave you with a catalog. I'm going to leave you with some more information. When I come back, we can certainly tweak this. We can make some changes before we roll out with our implementation meeting. Okay? I hope that makes sense for you guys. One of my other best tips that I would have is for you guys to not sell against something that the practitioner already loves. So I'll see in the Facebook group a lot of times people will say, I'm meeting tomorrow with a physical therapist. They carry an omega-3 that the practitioner had a really great experience with. What information should I bring that shows that our omega-3 is better than their omega-3? I personally, that's not what I am as a consultant. What I'm doing as a nutraMetrix consultant is I'm going in, I'm doing a full analysis of their business, of their practice, of their needs, of their patients' needs, and I'm figuring out where there's some gaps that I can fill, that nutraMetrix can fill. We can partner together to make a positive impact on the practice, the patients, and the practitioner. And so I'm not going in there and selling against that competition. That's going to create a lot of friction. And unless you guys want to be, professional salespeople, which, some of you guys on this call, you might have a professional sales background like me. You might decide that you want to make this something that is full-time. But if you want to keep this part-time, if you want to, really just quickly and effectively make an impact, especially in your local community with your local healthcare providers, then I say that you don't go up against the competition. You figure out where there is a gap, where there is a need, and where you can serve and fill that need for the practitioner. All right, so let's go into some examples of how I come up with these patient protocols. My first example is going to be an orthopedic. So I'll use a traditional medical doctor. And in doing the discovery meeting, I figured out that knee discomfort was one of his main patient concerns. So the first thing that I'm going to recommend for small is I'm going to do what I call trial size, which is our 30 serving bottle of OPC3 in conjunction with a vitamin D. Because I know that the science and the studies say, that I think would be an appropriate conversation for the practitioner to have with his patients about knee discomfort. This is purely for illustration purposes, just so you guys can see how I'm picking the small, the medium, and the large. So that OPC3, that trial size, and that vitamin D, it's going to be a really great low barrier to entry. It is going to be a nice price point to start out with, but it's two nice small bottles. They're both the same. They're both 30 servings. So I'm keeping this really simple. I'm not putting together a complicated package as the small offering. Keeping it simple, and I know that those two products are going to have a really positive impact. Enough for, again, when the follow-up comes, that patient's going to say, you know what, doc, that made me feel better. I'm feeling a little better on the pain scale in terms of my knee discomfort, and that will support them. For the medium-sized offering, I'm just going to take what I had in the small, and I'm going to add on some additional products that would make sense. So I have the OPC3 and the D, and my add-on in my medium is going to be two more products, a joint support formula and an omega-3. So I can go from that jump of 2 to 4 products. That's fine. And I know that that's going to be a really, nice package for that practitioner to be able to offer. It's a little bit more complicated, the medium-sized package. And so it might be a little bit more complicated for some patients because now I'm mixing isotonics with our omega-3, which is a gel capsule, one of those capsules. I am now mixing some, 30-day servings with joint support formula, which is a 45-day serving. So I'm taking a lot of these things into account, when I'm putting together the small, medium, and large. A lot of it is how easy is it going to be for me to train the staff, to train the patients? How easy is this reorder process going to be? This is what's going through my mind when I'm making this offering. But these are some really great products to be able to go through with this orthopedic, really appropriate for his patient base. Now the large is everything in the small, everything in the medium, and then we're going to add on. So we have from our small our OPC3 and our vitamin D. In our medium, we have our OPC3, vitamin D, joint support, and omega-3. And in the large, the fifth product I'm going to add on is some daily essentials packets. And this is going to be my add-on product for a really great, general health, general wellness, for someone that really has a strong commitment to their health. They're really going to want these products. They're going to like them, that they're going to want to have some daily essentials packets to keep on hand. Maybe for a day that they're feeling like they need a little extra. Maybe because spring and summer are coming up, and those weekend trips, it's a lot to take your bottles and your gel caps and everything with you. So maybe you just want to throw in some daily essentials packets so you'll still have the benefit of the isotonics. And so that would be a really great, general wellness protocol in the small, the medium, and the large. Okay, so that's just to show you, how it's for the smallest impact. The biggest impact with the smallest barrier to entry. That's how I'm going to pick, and add on with those products. Now let's go through, let's say that I'm meeting with a cardiologist. And in the discovery meeting, this cardiologist is just seeing general cardiology patients. Patients with general, heart concerns. It's, that in and of itself is a specialty. When I'm meeting with a practitioner like a pediatrician, that's a specialty. I'm meeting with, a dentist. That's really great. That's pretty simple. A gastroenterologist, a cardiologist. I mean, it can it's intuitive to figure out, what their general patient complaints are going to be. I still always ask. I never assume. So I always go through and ask in the discovery meeting, to try to get a little bit more specific. But what I then will typically do is I will just then use the patient product guide for that specific patient concern to create my small, medium, and large. So we have patient product guide number 42 is for cardiovascular health. And in that product guide is listed the heart health system, Lipotrim on its own, CoQ10 in both our gel cap form and also in the isotonics form, resveratrol, astaxanthin, and red yeast rice. It's a lot of products. So in going through, again, I kind of just went with my gut. I looked at all those and I said, what's the one product out of all those, that's going to have a big impact if I was going to put that as the small? And I just started the heart health system because the heart health system has, some really great ingredients in it. It has the Lipotrim, it has some Triactive, it has omega-3s in it. So it's got a big bang for its buck, and it comes in a nice box. It's really easy for the patient to use. It's all individually wrapped. They travel really nicely. And so I think the practitioner, that would be a really simple, small offering, if we're talking about cardiovascular health. Adding on to that, well, what is the heart health system missing? Well, I think coenzyme Q10 is really important. And then I would pick, maybe one of the antioxidants. In this case, I think I would go with coenzyme Q10. I think I'd stick to, so we have our little packets for the heart health system. So I would probably then go, with our capsules, not our isotonic coenzyme Q10. And then I might add on, and just sticking with that theme, some astaxanthin, as the antioxidant, that has that great cardiovascular support. So the medium is going to be the heart health system with coenzyme Q10 and astaxanthin. I hope I'm saying that right. It's such a hard word to say. And then adding on there for the large, I think that I would add, some red yeast rice, because that's a really unique product. That's not a product that a lot of other practitioners are going to have. That's not a product that the patient's going to say, well, I'm already taking red yeast rice. Like we hear sometimes they say, well, I'm already on a multivitamin. I don't think that that's quite as common. And so in my large size offering, for really total cardiovascular health, we have the heart health system, coenzyme Q10, astaxanthin, and red yeast rice. And that's what I would pick. But I would provide the practitioner with the entire cardiovascular health patient download, which is download number 42. I would say, we can certainly, change some of these, just based on what you would like to offer to your patients. I always say the health professional is going to decide what they're recommending to the patients. The nutraMetrix consultant, or the NC, is just going to guide the conversation. We're going to say, yes, doc, I understand that coenzyme Q10 is really important to you. So let's talk about, would you like to offer this in our gel caps or our oil-based caps, or would you like to offer this in our isotonics form? And let's look at what else you're offering within this package, and let's see what makes sense. So it'll be really easy for your staff at checkout to be able to explain it. So these are some things that I'm thinking about as I'm rolling through. All right, let's just do one more example. I'm going to do a massage therapist. Now, massage therapist, they'll see a lot of inflammation, they'll say, or just pain that maybe they think comes from inflammation. I've heard, stress sometimes. Sometimes I've heard, in a discovery meeting, I've heard GI upset, GI complaints from their clients. And so let's just say that this massage therapist says, you know what, Sarah, I think just about everyone is stressed, and they're always saying, what can I do for my stress? And so in this case, since we don't have a stress support patient handout at this time, what I did is I actually just looked at the stress kit and I said, well, what's in our nutraMetrix anti-stress kit? Well, there's Bliss, there's an activated B vitamin, and there is OPC3. And so I'm just going to take those three products and put them into a small, medium, and large. And so looking at those three, I think that Bliss is the easiest product to implement that's going to have, the greatest results in terms of, in terms of stress and supporting a client's stress. And so my small would be Bliss. My medium offering is going to be Bliss, and I chose for this activated, vitamin B. So I said Bliss and activated vitamin B for the medium. And the large, I just went with the kit in general because that's going to be a really nice savings. It's going to be offered as a kit. And then the practitioner can break it up for the small and the medium, make a bigger profit margin because they're ordering it in the kit. And that's going to be really great too. And so I just wanted to give you some examples. I mean, you might meet with a practitioner, and like with our orthopedic example, you're feeling like you need to pull science, you need to pull some knowledge, you need to do a little bit of like guessing as the nutraMetrix consultant to see exactly what's going to fit, with the practitioner, with the way that they treat their patients and the offerings that they make. You might use one of our patient protocols in our downloads, our patient product guides, like the cardiovascular support. We have a optimal health patient product guide. We have some really great ones, and looking at the products that are offered and then putting them into a small, medium, and large. Or like I did with the massage therapist, you might end up using one of our kits, making that kit the large offering, and then breaking up the small and the medium, as a breakaway, from the kit. And so this is just how I am going through and I'm picking products for the proposal meeting. I don't want you guys to get so hung up on it. I see a lot of questions in the Facebook support page that'll say things like, I'm meeting tomorrow with a urologist. What would you recommend for urologists? Well, there's a whole range of what you can offer for urologists. And one might not recommend the same thing that another does, just based on their patient population. So if you haven't, you really need to go back. You really need to dig through that discovery questionnaire. Make sure that you understand exactly what 8 out of 10 of the patients, are complaining about, and how you can make a great impact on that patient, the practitioner, and the practice. My name is Sarah Tugender, National Field Manager with nutraMetrix, helping make this your most effective and efficient year with nutraMetrix. Stay on for a couple minutes for questions. I hope this was helpful for you guys. You can chat or put some questions in there. Hey, Karen. Sometimes I know it's a little delayed on my end, so. Here we go. Awesome. Sarah Dentist. I have one. Can you review this one too? Yes. Okay. This is from Zion Enterprises. It's so tough. I've gone to dentists and I've been to dentists and they really want to do something for weight management. And I roll out a small, medium, and large when it comes to TLS or some weight management support. I've been to other dentists and their number one thing is for periodontal disease. I've been to another one and they really feel like there is a link between gum disease and cardiovascular health, and they have a strong platform of cardiovascular health. So honestly, you have to go through with the actual practitioner, do the discovery meeting, and do some research. Especially with dentists, I like to ask them, what kind of science are you reading about? Are there any supplements that you're comfortable with recommending? I mean, some things that I've heard in the industry, coenzyme Q10. I've heard some things for probiotics. I have heard some things for some vitamin C. I've had some dentists that really like the profile of OPC3 for their patient base. I think those are a lot of products, though, that I just mentioned. So you really have to specifically figure out. Also, is this a dentist that does their own implants? Are they doing surgery? I've had some dentists, and they like to put something that's more of a natural anti-inflammatory around doing their surgery. I've had some dentists that like to use probiotics, around their oral surgeries. So again, it's very specific to that dentist. And I like to say, what have you been hearing from your patients? When you've been going to conferences lately, are there any hot buttons in prevention that you would like to see added, or that you're feeling like is coming up in conversation and you just like to get some more information about? And I can help provide you with the science and the literature and how that would help your patient base. Do I discuss dosing when recommending OPC3? That is a great question. The dosing is always up to the practitioner. So I never like to tell them what to do or what not to do when making recommendations, but on the bottle, it does say, how to do a loading dose. We do have some documents, but how to do a loading dose. And then from there, I mean, I'm not really telling them how to dose, because that's really beyond my scope, of what I can do. I can just say that I would be more than happy, if they wanted to talk to another clinician to talk a little bit further about dosing if that came up. But otherwise, yeah, I'm just recommending what is on the bottle, and then letting them, at their discretion, if they want to play around with it, that's totally up to them in terms of dosing. But I don't make dosing recommendations. It's a great question. Yes. Oh, good question. WR Shopper. Is the small, medium, and large all presented in the proposal meeting at the same time? Yes, it is. Yes. And there are some other meet-ons on how to conduct the proposal meeting by Reed Prescott. I don't think Lexi's was recorded, and I'm sure I'll do some in the future. But Reed's are really great, and it shows exactly what you're presenting. And you're presenting its ESP, the education, the science, and the profitability of the small, the medium, and the large. Yep. But you're mainly just presenting, phase one and one regimen that you're rolling out. So definitely download the practice planning guide, and you'll find the proposal meeting agenda. You can see all the information that's there, and bullet point by bullet point what you're supposed to talk about. Okay, back to Zion. During the discovery, the dentist was interested in periodontal and the link between that and cardiovascular. So that was easier to help patients connect the dots and buy and take the supplements. Okay, so I mean, those are two things. Those are like whether it's periodontal or cardiovascular. And at that point, I mean, I would either pick which one we're going to roll out for phase one and which one we're going to roll out for phase two. I would then, you could even go into a proposal, with both prepared, and then just say to them, which one do you think you would want to roll out first? And that's the one you're going to present the education, the science, and the profitability. I wouldn't do both phase one and phase two, just because I think that a shorter amount of time, and really digging into one with a practitioner is going to be so much more powerful for you to keep focused and keep simple. And if this goes really great, we can get this off the ground, we can roll out with phase two really quickly. In the file section of the nutraMetrix support Facebook group, Brandy Murphy recently posted a great presentation on periodontal disease. You can certainly Google. There's some great presentations. There's stuff on the web. I'm always Googling and finding out, the whatever it would be, like the ADA, probably the American Dental Association, what their guideline is for periodontal disease, what their take is for cardiovascular disease. If you're just figuring out, so if this was, if it was I was going to talk to an OBGYN, I would look up, the American Board of OBGYNs and see what their take on obesity was, what their take on infertility was, and try to figure out, what they're recommending that's like lifestyle factors, to try to help. And that would be the info that I would bring to the practitioner. So just recently, I did bring that periodontal presentation to a practitioner to say, I put together a periodontal regimen for you, but this is the information that I was going off of. Because all the time, sometimes they'll reach behind them at their desk and they'll pull a study and say, well, actually, I was just at a conference a couple weeks ago, and this is the latest. We're really working together for that. Okay, so any suggestions about pediatrician or psychologist in reference to nutrition for learning for ADD, ADHD patients? Well, if this was going to be for, okay, so this is great. So for this, pediatrician and psychologist, really different. I'm just going to talk about pediatrician because psychologist, I think last time I checked, you'd have to just check again, that they're on a case-by-case basis with nutraMetrix. So I'm just going to stick with pediatrician. I would really go with just our pediatric regimen that we have. So that's in downloads. I'm just going to Children's Health, page download number 42. And then when I'm with the products and I'm looking for the science, I'm going to go through the science and see what science says it's for ADD. So I really would go through. So if I jump on, that patient product guide for Children's Health, what's going to come up here? Let's see, like our multivitamin plus, OPC3, probiotics. So maybe what I would then do is go to nutrametrix.com. I might pull up DNA, OPC. From there, I'm going to look at the Isotonics DNA product, and I'm going to go through the science and see if I can read any of those headlines and find any science that's related specifically with pycnogenol and ADD, ADHD, and that's the study. So if I'm going to make that correlation and pick the product, I want to pick exactly why. If I'm not just using like a general pediatric protocol, a general, like I said, like stress, I just use the anti-stress kit. That's a good question. I hope that helps. Oh, good. That's exciting. That's a huge patient complaint, I'm sure. So I'm right here on science. I'm going to read more. And then what I'll typically do is actually this just popped out to me. I don't know if I can I chat back to you? Oh, I think I can. Like I just found this, so I would put this into a Google search. This was just one of the studies that was right here. So it's just, what the rationale for integrative management is. So I would just go line by line and I would see, if there's anything else about ADD that they're citing here for studies. I would go look up that study. I would print out that study and I would bring that study to my meeting. And sometimes then I'll go off and I'll do some Google searches as well. I love the science behind it. Oh, Susan Luke Harris, chronic pain. So something like chronic pain, I really am gonna ask, like, if we think for the practitioner now, just because I know a little bit about it, but if I didn't know as much as I did about chronic pain, I would maybe say first, like, well, where do you, what's another complaint, or where do you think, doc, this chronic pain is coming from or stemming from, or, what is your mode of treatment for this chronic pain? Is it an endocrinologist that's seeing chronic pain, and they're seeing chronic pain as a result, where they're looking to support maybe the immune system, um, and help with support for that? Is it a chiropractor that's seeing chronic pain, and this might be as a result of chronic inflammation, and so they want something that either has natural anti-inflammatory properties, maybe they just want like optimal wellness? Is this chronic pain, and this is a practitioner that's part of the Academy for Anti-Aging, and they're really feeling like, there's things in the body and they really need to support the aging process, and I might come in a little bit more with some of our prime products to support that. So I don't know. I mean, Susan, without knowing like exactly, the practitioner, and knowing, how they're treating it, and what this is. I mean, is this physical therapy? Is this chiropractor? Is this an endocrinologist? Is this just an internal medicine physician? Internal medicine. Okay. And then, who is he referring to for this chronic pain? Or what is he comfortable with? I mean, internal medicine might be just more comfortable with, just general optimal health. And again, you can find some great studies because OPC3 is in there, and you're going to find some great studies. You will find some nice things on OPC3 that might spark that internal medicine GP's interest and kind of lead him down that discussion, where he feels comfortable. All right, good. Yeah, I hope that helps. And anyone really. I mean, if we can run through some more of these, I probably will redo this meet on, do this again, as we can continue to have this conversation. But I think it just really comes down to like asking those kind of questions. And so maybe we will talk about, the link between the discovery meeting, and I need to stress that a little bit more, and how you're going through the discovery meeting, knowing that you have to go home and create the proposal. And that it's okay to take a step back. Like this just happened to me last week, where a massage therapist I was having a really hard time getting it out of her what her top 3 patient complaints were. It's like, I don't know, they come in for everything. It's like, okay, well, if we could just name, so that's where I use out of the last 10 patients, clients that you saw, what were 8 of them complaining about? And with a little bit of digging and pulling, I figured out that stress was a big one. Stress and just inflammation. But stress kept coming up in the conversation. And I kind of felt like stress maybe was also important to her. So, and she partners with a lot of yoga and meditation practitioners. So I just thought it could kind of fit nicely into the referral partners that she had if we could come up with an anti-stress regimen. So that's what I ended up leading with. And I just kept it really simple with just breaking up our anti-stress kit. But I sort of knew, okay, well, after this meeting, I have to come up with a proposal. So if I don't get out of her, well, what does that mean? And is that really a patient complaint that I can translate into a regimen? And so if I can't translate it into a regimen, I'm going to slow down and I'm going to say, wait a second, like, let's explain this to me. And how are you treating this? And what is it presenting like? And how are you testing for it? There's a lot of these questions in the discovery meeting that as you get more well-versed in the discovery meeting, you'll understand where it says you offer any testing for your patients. That kind of goes back into like, well, how are we measuring something like chronic pain? How are we measuring, our dental health? So yeah, everyone that's coming into the dentist is coming for dental health, but how are we measuring dental health? Is this whether or not they need an implant? Is this from a periodontal disease? Or do you have other markers? Are you working with other practitioners? What else are you doing? I went to a dentist that was doing a lot of Botox. And he was doing Botox for TMJ and then was saying to their clients, but for $100 more, I'll get rid of your number 11s on your forehead. And so going into a conversation about maybe anti-aging would have been really appropriate. Are people coming to him for anti-aging, or are they coming to him for TMJ? I don't really have a solution for TMJ, but I could put in an anti-aging protocol. All right. We will definitely continue this discussion. I think this was great. I think we should just jump on live a couple times and continue this discussion and do this again. Yes, no, thank you guys, and have a great night. And to everyone that I will see this weekend in Cherry Hill or the following weekend in St. Petersburg, please let me know that you've been on my meet-ons. It would be great to meet you guys in person. So there's a face behind that camera there. Have a great night. Thank you.